We became familiar with the University of Iowa Stead Family Children's Hospital on September 10th of 2016 when Veronica became extremely lethargic. She couldn't move any of her extremities. We went to a local hospital and they ran a bunch of tests and couldn't find anything. And by about 4 o'clock in the afternoon, they came back and said, there's an ambulance waiting and you're going to the University of Iowa.
When Veronica was about 16 months old, she was a pretty normal little kid, chasing her sister around and starting to say some things. Late one week in September, she got very sick. It was a lot like having an infant again. Her head was lolling to the side and she was not very responsive to anything. You could pinch her and she wouldn't react. And so we were obviously very, very concerned and very fearful. Took her to the local hospital and they ran all the tests they could think of, and they got to the point where they said, we might need to send you down to Iowa City, the University of Iowa Hospital.
When we got to the emergency room here at the university, they were all prepared for us and they ran a whole bunch of tests. So they obviously had started IVs, they took a ton of blood draws, they did an MRI, they did a CT, they did a couple spinal taps, and she never moved.
They ran a scan of her spinal cord and were sure that I was going to get the results that they needed to correctly diagnose it.
The next morning, we received a phone call from our neurologist, Dr. Lutz, and she said that a specialist had reviewed the MRI and that they had found something. When we talked to her, she said that they had found a lesion on Veronica's spine that was running transverse. It was an autoimmune disease or an autoimmune disorder called transverse myelitis. And basically the way that it was described to us was that her body thought her spinal cord was an infection. And so her body was trying to kill off her spinal cord at that point. And we stayed another few weeks there as the doctors and nurses worked with Dave and I, teaching us how to care for our child in this new situation. We had to learn how to place an NG tube. We were in charge of her suction because she still had not been able to, sit, stand, swallow, any of those faculties. None of that had returned. And so now we were really kind of accepting what our new role as parents of this child was going to be.
Today, I would say Veronica is doing pretty well. She's going to be in second grade this fall, has made so much progress. She's got some hearing loss, and so therefore has had some trouble with speech, but working with therapists and the teachers at school, she's come a long way with her enunciation and being able to speak fluently and efficiently. And my wife and I think both intentionally use as many big words around our girls as we can to try and get them to be able to have a good extensive vocabulary and maybe sound like they know what they're talking about.
When we think back to where we were in 2016 and you think about all of the things that we weren't sure that she was going to be able to do. You're looking at your child laying there and you kind of flash forward to all those things that they should be able to do, to run in the park, to play, to dance, to swim, to do all these things. And for whatever reason, you're not sure that that's going to happen.
This children's hospital is physically it's a phenomenal place and it's an impressive place, but that's just the shell. That's the facade that you see on the outside. What counts is the people that are walking the hallways, and all the people here who did not back down, didn't stop for a moment. I don't know if there are words to express how blessed we feel and how deeply grateful we are.
We wouldn't be where we are right now without them, without their expertise, without their kindness, and without their compassion towards our family. We were lost, and they gave us a path. We had to put all of our faith in them, and they did exactly what they knew to do, and they saved our little girl.